Okay, there we go. Hi, everyone. Welcome to this week's Entwine exclusive. My name is Ariel Sokoloff. I am the Senior Engagement Manager at JDC Entwine, and I'm coming to you from my parents' basement in New Jersey. For those of you who are new to our organization, Entwine is the young adult platform of JDC, the Joint Distribution Committee, which is the world's leading Jewish humanitarian organization operating in over 70 countries worldwide. Entwine Exclusive is a weekly series we launched when we shifted to this virtual world to give you a behind-the-scenes look at how JDC responds to global crises and to help you feel connected to the global Jewish world. Last week, we had a fascinating conversation with Diana Ginsberg and Avital Sandler-Leff, who spoke about the impact of COVID-19 on the developing world. If anyone is interested in watching that recording, you can find it on our website. It was a really incredible session. And this week, we're going to explore COVID's impact on Israeli society. But before we dive in, I just want to go over a couple of housekeeping tips. Miriam is here on Zoom monitoring the Q&A and the chat for questions. And we have Shauna and Tadala over on Facebook getting us set up over there. We have a designated time for Q&A at the end of the session. So feel free to post questions throughout and we'll be sure to work them in. So as I mentioned, this week's topic is exploring the impact of COVID-19 on Israeli society. I've personally staffed 2 Entwine trips to Israel, and both times I've been blown away by JDC's work with vulnerable communities, and I'm particularly inspired by the response right now. On JDC Israel's Facebook, they've been putting out videos and updates highlighting the work they're doing with elderly, people with disabilities, youth at risk, the Bedouin community, the ultra-Orthodox community, and so much more. So I'm really excited to learn more about the decisions Israel has been making during this pandemic and some of the ways that JDC has been responding. This week, I'm particularly excited to have Eden Adler, who is going to be hosting our conversation with our featured speaker. I've known Eden since 2015, when she served as a year-long Jewish Service Corps Fellow working for JDC Israel, and she has lived in Israel ever since then. Eden is currently a software engineer working at an insurance tech startup called Lemonade. And I highly encourage you to check out her Instagram account called What the Tech, where she tries to make complex technical concepts more accessible and relatable, which is something I definitely need when it comes to software and coding. She also strives to empower others to pursue a career in software engineering as one of the team members behind Women of Startup Nation. And she's a board member of Alum in Tech, working with new immigrants in Israel to get connected to the tech sector. So Eden, it's great to see you, and thank you so much for being here. I'm going to turn it to you.
Thank you so much for having me. I'm really excited. I'm excited to be interviewing Professor Michael Hartal. Michael's a public health physician by training and has spent the majority of his career strengthening population health practice and policy in the public service. Michael has served as a medical officer in the Israeli Defense Force for over 20 years, attaining the rank of lieutenant colonel. He then went on to command the IDF Public Health Agency and later headed the Academy and Research Branch of the Medical Corps. He also served as the commander of the IDF Medical Cadet Program at the Hebrew University Medical School and is an associate professor at Hebrew U, where he teaches public health, research methods, and leadership skills. He has authored over 90 research papers. So that leads us to his current role as executive director of Myers-JDC-Brookdale Institute. So Michael, thank you so much for being with us.
Thank you, Eden. It's a pleasure to be here. And Ariel, thank you so much for providing this wonderful platform for us to be on.
So let's jump into it. So you've had a really interesting life journey, Michael. So can you tell us a bit about that?
Sure. I was born in New York, and I lived in Brooklyn Heights until I was about 16. And back in the mid 80s, I moved to Israel with my family. I finished up high school here in Israel. Wasn't sure what I wanted to do as part of my army service, and I ended up applying to medical school and magically getting in before my army service. And so I deferred my service until I was finished with my medical training. And then I went into the army, fully ready and prepared for medicine when I was done. Went into the army in 1996, did a bunch of G.I. Joe stuff, fell out of airplanes and looked for bad guys. And found myself at a certain point between jobs in the army and looking for something interesting to do. And found myself in a situation where the only available position was in public health. And so I sort of reached that pretty much by accident and by default, having nothing else to do. After a short period when I said, look, I'm really just going to do this public health thing and then get out of here because I want to go be an emergency medicine physician. Ultimately, I decided to stay for 4 years to do my residency and then to quit the army. I ended up staying for 21 years and I retired pretty recently ago. It was 2.5 years and 1 corona pandemic ago. And you mentioned some of the cool stuff that I got to do. I got to run a public health agency for the Israeli military. I actually spent about 20 years preparing for a pandemic and then sort of stepped aside 2.5 years before it actually happened. I also got to spend some time, as you mentioned, in the academy and research branch. And I was responsible for some medical education there and also for oversight of the medical corps for research institutes. I spent some time at the Ministry of Health. That's like the Israeli Department of Health and Human Services. I spent time there in the Office of the Director General, and I spent time with the head of the Public Health Service. And in 2017, I got an unexpected call just as I was sort of wrapping up my military career. And someone on the other end of the phone said, we're from JDC. Would you be interested in an opportunity at the Myers-JDC-Brookdale Research Institute? To which I said, I don't really know what that is. I'd have to look it up. Thanked them very much for the call. Went and did some reading, got back on the phone and said, yes, this is the dream job. And I'd love an opportunity to work with JDC and to come into the Brookdale Institute, which pretty much brings me to where we are today.
Amazing. And that was actually my next question. So Myers JDC-Brookdale is, even though I'm familiar with it from being a fellow, I had no idea what it was before and I had never heard of it. So it's one of the less well-known areas of JDC's global activities. So can you tell us a bit about the Brookdale Institute and what you guys are doing there?
Sure. I actually feel a little better that you hadn't heard about it either, because that's how I felt when I got that call. JDC does a lot of interesting stuff around the world. A lot of it is in providing services. Other parts of it have to do with international development. And we are actually Global JDC's data and research arm. The Brookdale Institute is Israel's leading center for applied research on social policy and human services. We use meticulous study and rigorous research and extensive knowledge to help improve decisions that affect people's well-being. So at the Institute, we inform policy, we advise programming, and we try to improve services for individuals, for their families, and for their communities. The Myers-JDC-Brookdale Institute, or as we lovingly call it, MJB or Brookdale, is in essence a partnership between Global JDC and the government of Israel. We've been in business since 1974, so it's about 46 years of experience. We work mainly with the parts of the Israeli government that we refer to as the social ministries. So that's the Ministry of Health, Labor and Welfare, Ministry of Education, Finance, Social Security. But we also work with a bunch of other ministries that form out the government, such as the Ministry of Justice, the Ministry of Housing and Development, Religious Affairs, and actually quite a number of other public institutions. We're about 150 staff. Over half of them are social scientists, researchers from many different disciplines. You can find social workers and sociologists and anthropologists and criminologists and epidemiologists and public health specialists and economists. We really all come together to work in different fields of research, which include health policy, employment, aging, children and youth at risk, people with disabilities, domestic violence, quality assurance in the public sector, to name just a few of the areas that we work in. We have a team that's dedicated to the Arab population, which represents just over 20% of the Israeli population. So we're really concentrating efforts on working with that population as well. And that team is currently working on a very big multi-year project on Bedouin Arabs in the Negev. So it's a really big mix of stuff that we work on, a very large multidisciplinary team, and we get to do a lot of cool stuff.
Yeah, it sounds like it. And so you're an epidemiologist and specialist in public health, but since you're not in a position that's currently carrying the direct responsibility of managing this crisis day to day, I'm interested to hear your perspective on the pandemic and your thoughts on that. What's going on now?
Thanks, Eden. It's actually an interesting position to be in. You train and train and train and prepare, and then just when the money time comes, I don't know, one way to look at it is to be sidelined. Another way to look at it, though, and this is the way that I prefer to look at it, is first of all, it's someone else's responsibility now, and everyone gets a chance. But it does allow me to sort of look at the situation at an arm's length, and it's like sort of close enough to know what the decision-making process is, but distant enough to maybe get a little different perspective because I'm not on like a 24-hour decision cycle. Well, I've been thinking a lot recently about what can we learn from a pandemic. It's obvious to all of us that some of our systems were caught unprepared. The decision-making process isn't always clear. We're learning a lot, but we're sort of learning it on the fly. And so I thought that maybe I could try to capture some lessons from the pandemic for future generations and future pandemics. So maybe that's one way to approach it. And if it's okay with you, maybe go through some of the lessons to be learned from a pandemic.
Yeah, great. Okay.
So the first issue that I thought about is the choice of a disease name. Is it accurate? Is that descriptive? Is that the disease that we're talking about? I mean, this is going to go down in the history books. We could have done a better job on picking the name and maybe having something a little more accurate descriptive. Another lesson has to do about the geographic origin of a pandemic. I mean, there's a lot of hypotheses going around about where exactly pandemic started, but that's not really clear even today. Curiously, there's a lot of attention being devoted to this question about where it started, and actually a lot of geopolitical effects, including scapegoating that's going on about who's responsible and where did it start. Something else that interests me very much has to do with the biological origins of the virus. Is this a zoonosis? Is this really a virus that jumped from an animal to a human? Is it because of human-animal interactions? Is there something we should be learning about human habits and the way that we interact with animals and with our environment to maybe prevent pandemics? I think that's a really important lesson to learn. Maybe a little more on the negative side. I noticed that there was a lot of downplaying of the significance of the pandemic at the start. We heard a lot about, oh, this is just like the flu. It's seasonal. There's nothing to worry about. I don't know. I'm a little skeptical about that message, and I think that maybe we can learn about that for future generations. There's a lot of attention being paid to counting the dead, right? How many people are dead? Do we know for sure? Are we over-reporting because people have died from other things? Or are we under-reporting because people are dying, but we haven't tested them for
Right.
pandemic disease? And maybe, in fact, they're also victims of the pandemic. So this whole thing about counting the dead and how accurate is that? And one final one has to do with the political and the economic considerations in a pandemic. These political and economic considerations have definitely led to differential speed and compliance in implementing the population-wide social distancing and the lockdown. Based on political considerations and economic considerations, we've seen places that have responded very differently in taking measures. And the difference in the results is staggering. And so I think the influence of business interests and of uninformed politicians is crucial as a predictor of bad outcomes. Oh no. I'm actually a little embarrassed right now. I'm sorry. You're really not going to believe this, Eden, but I've actually been reading from the wrong page. All of these lessons that I've learned are actually lessons from a pandemic, but these are all from the 1918 pandemic. And these are not really lessons that we're learning from the current pandemic. So I apologize for that, but let me go back and talk about some of the lessons that we could have learned from the 1918 pandemic. So the first one I had was the choice of a disease name. Is it accurate? Is it descriptive? That was actually not about COVID-19. That's about Spanish flu. The Spanish flu did not, under any circumstances or any stretch of the imagination, originate in Spain. In fact, during World War I, Spain was a neutral country and was not subjected to military censorship. And so the countries at war didn't want to report on their losses and about their troop weaknesses, and so they were not reporting. And the only place that the reports were coming out of were from Spain. And so that name stuck as the Spanish flu. And it's been 100 years and we haven't been able to shed that yet. That's with us forever. That next point about the geographic origin being hypothesized but not clear, you know that 100 years later, we don't know exactly where the Spanish flu started. Did it originate in Kansas? Possibly. Did it originate in rural France? Possibly. Did it originate in Southeast Asia, the way that a lot of other diseases and flus generally move from east to west? And we know that in previous rounds of coronavirus, that's what happened with SARS or maybe with MERS. It's still unclear. So we've had 100 years to learn about that, and we actually still don't know. What about that issue of biological origin of the virus? Is it a human-animal interaction? So we're all talking about, did it start with bats, and why are bats interacting with humans? And it started an open animal market in China. It's been hypothesized that the Spanish flu originated in a wild duck. We know that birds carry flu viruses and excrete them in their feces. They spread them through land and through water, throughout the animal kingdom. Any flu virus that a human has probably started in a bird at one time. Birds give it to pigs and pigs give it to humans. We've had 100 years to figure that out. We're really not a lot smarter about that now than we were 100 years ago. What about downplaying the significance of the start? This is just like the flu, nothing to worry about. In 1918, the Surgeon General of the United States said, if proper precautions are taken, you have no cause for alarm. Leaders did very little, and they may in fact have misled the population during the first stages. Mayors, governors were instrumental in either getting their populations ready and safe, or not ready and keeping them at risk. Counting the dead, how many do we know for sure? I don't know, at first the reports were 20 million people in the 1918 virus. That went up to 25 million. Ultimately, it went from anywhere from 50 million to 100 million. In fact, every number is a winner. Does it matter? Not really. A lot of people were dead. And 100 years later, we don't know the answer. We certainly don't know the answer now about the COVID pandemic. And I don't know why we're spending so much time, or do we have a good definition about that? And finally, the last point that I wanted to make, I think is the most important one here, about political and business considerations having an effect on how populations are experiencing a pandemic. Philadelphia was one of the first cities hit. It echoed the line of the federal government in 1918 and downplayed the significance, nothing to worry about. It was a rational decision. They didn't want people to panic. The health board in Philadelphia declared that the disease had already reached its zenith and was in fact retreating. And so they decided not to cancel the Liberty Loan Parade, which was for a good cause. That was to promote government bonds to finance the First World War. And so that parade was not canceled, despite professional opinion, called for the cancellation. 200,000 people participated in that parade against public health advice. Within 3 days, 31 hospitals in Philadelphia just ran out of bed space. And after 5 days, after 5 full days, the schools were closed, the churches were closed, theaters were closed. Interestingly enough, the bars were open for 1 extra day. And within weeks, there were thousands of deaths. All the businesses were closed. The public transportation shut down. Civil society had to organize to help distribute food and medicine and take over for a failed government. In New York City, the statisticians stopped counting after 33,000 deaths. However, if we look elsewhere, St. Louis, immediate general order by the mayor to close all non-essential businesses and other social distancing measures like we're taking today. People were instructed to stay home. Handshaking was prohibited and a lockdown was strictly enforced. San Francisco, they started response planning before the pandemic hit, and they had the full continental United States from east to west to plan. Public schools were closed, public gatherings were prohibited, and while Philadelphia was still denying the severity of the pandemic, San Francisco was distributing 100,000 face masks. The police were enforcing mask use, and there was a much better outcome. So, it seems, unfortunately, that we're sort of losing the lessons from 1918 and 1919 and 1920 and 1921. And if there's anything that I think could be a take-home message here, is that COVID is here to stay. This is not going to be the pandemic of COVID-19. It's going to be COVID-19 and 20 and 21 probably. Maybe just to finish up on this main point that I'd like to make here, the historian Alfred Crosby authored a book in 1976 called America's Forgotten Pandemic. And it's pretty much considered the definitive history of the 1918 Spanish flu pandemic. And Crosby wonders in this book about the disappearance of the pandemic from American memory. He goes to the Reader's Guide to Periodical Literature, where you can find all the references in popular magazines and newspapers. And he looks at how many inches of column space are dedicated from 1919 to 1921 in the Reader's Guide to Periodical Literature to some popular issues. So it turns out there are 47 inches of column space devoted to citations on prohibition. 47 inches. There's 20 inches devoted to Bolshevism. 13 inches devoted to baseball stories. And only 8 inches devoted to the flu. So here's this world-altering, changing pandemic once in a century, and it's absent from the periodicals of the time. The American novelist, John Dos Passos, who crossed the Atlantic on a troop ship on which soldiers were dying of the Spanish flu every day, has just one single reference to the pandemic in his novel, 1919. If you look at the writings of authors of the day, F. Scott Fitzgerald, William Faulkner, Ernest Hemingway, they all witnessed it firsthand, and it's largely absent from what they wrote. And again, our historian Alfred Crosby noted 40 years ago that the average college graduate born since 1918 literally knows more about the Black Death of the 14th century than about the 1918 pandemic. That was 40 years ago. And unfortunately, my prediction is that we too will fail to fully learn and document and transmit the lessons that we, all of us here on the call, are learning day to day. We won't transmit them to the generations that follow us. And unfortunately, I think that the pandemic of 2119 is pretty much going to look like the pandemic of 2019, which is pretty much the same as the pandemic of 1918. And it's just because the viruses are smart enough to wait just long enough for everyone that experienced it to die and to forget. One last thing about that, all the photographs from 1918 are in black and white, and it gives us like that old-timey feeling. And even if it's just subconsciously, and even if it's purely unintentional, it gives us a little feeling of superiority that back then people weren't as smart as we are today. Trust me, they were just as smart. We might know a little bit more about virology and vaccines, but our record keeping might be a little better. But other than that, we're fundamentally doing exactly the same thing that we did 100 years ago. And we're missing stuff that's not 100 years ago. We're missing stuff that happened 3 years ago too. Global vaccine manufacturing capacity is still insufficient to meet the demand. We can't meet the demand. There's not enough factories. Although the President of the United States has the final word on everything in general about the pandemic, nobody seems to be fully responsible for America's outbreak response. It's very difficult to communicate continuously with state governors and to ensure a coordinated national response on that. Do we have a federal unified response versus a regional and local response? That's very unclear. And lastly, the public health system that can fight pandemics is severely underfunded due to federal administration budget cuts to global health security in the US. Unfortunately, all of these observations were made by senior health officials 2 years ago during a pandemic simulation exercise held by the Johns Hopkins Center for Health Security. So we're not just missing those lessons from 100 years ago, we're still missing them 2 years ago and unfortunately today as well. So I guess in a nutshell, my message isn't too enthusiastic or too optimistic. We have an opportunity to try to learn from the past and we can do it, but unless we change something fundamental, we'll probably forget everything we're learning today in the next century.
Okay, well. No, it's really interesting. And you spoke a bit just now about the US and how things are going there. I'd love to hear about, you know, what's going on here? How are we handling things in Israel? Yeah. Okay,
so I think in Israel, the numbers talk. It's, you know, show me the data. That's an epidemiologist, show me the numbers. By many, many parameters, Israel seems to be doing a really good job. The number of deaths, the death rate per 1,000 population, the number of critically ill COVID patients, number of mechanically ventilated COVID patients, the rate of the introduction of new cases throughout the crisis to date, what we call, you know, flattening the curve. We're doing a good job in Israel. It came at a cost because we swung the pendulum really, really hard in favor of health at all costs. I think the population did a good job of sort of taking that in stride, and evidently the risks were communicated because I think that the population realized just how important it was going to be to maintain all of these strict guidelines. Currently, over the last 2 weeks or so, we're seeing a lot of criticism of politicians and of senior civil servants. To be sure, there's always room for improvement, and we definitely could have done some parts of it better. There were mistakes that were made along the way. The communication could have been better, and I think that maybe we could have heard more voices and been a little more transparent and how the decision-making process was going on. And even if the results are good, and the results are good, but I think the process was a little bit flawed. But seriously, there's no such thing as making these big, tremendous decisions without making some mistakes along the way. And I do think that we have to strive to do as best as we can. But I think that something about the tone might be a little exaggerated right now. The other thing is, what can we really expect from government officials? I mean, how did we choose them? Did we choose our government officials based on their previous pandemic experience? No, of course not. We chose them based on other criteria, and they, just like us, have been thrust into this unprecedented historic event. I think that the decision here, the societal decision, it wasn't just government's decision, it was the societal acceptance of swinging the pendulum hard towards health was good. But as a public health expert, I can tell you that only half of public health is health, and the other half is public. And I think that now is the time to let the pendulum swing back towards the center. I think the clearest example of this is the autonomy of older adults. We literally locked down everyone over the age of 65. that may have been important until we sort of got a hold of things, understood what was happening. Everyone understands the risks, and I think that now we're being a little too patronizing and a little too paternalistic towards older adults. Everyone understands the risk, and I think this is the time to sort of relax some of those restrictions and allow adults to be autonomous and to make decisions for themselves. But, you know, in Israel, having this type of a discussion in a Middle Eastern Jewish way can be expected. It's loud, it's messy, there's a lot of yelling involved, but I think that Israel is going through a good process right now. I think it's time to reconsider some of those restrictions, and I'm sure that we'll figure it out.
Ariel, do we have time for one more question? Or is it time for the audience's question?
We have time for one more question, and then
Okay.
I'll pull it over to the audience. Yeah, thank you.
So I'd love to hear from you, Michael, about like, where do we go from here? What's ahead? What can we expect?
Okay. So, you know, they say it's very difficult to make predictions, especially about the future. So I really don't know what the next steps will be. I can tell you what I think they might be. I think on the health front that we can expect another wave. The virus is not stupid. People tend to be, individually not. Of course, individually people are not stupid. As a whole society, I don't think that we're great. I think that society will become complacent in social distancing. I think that we'll be lax in, you know, staying on our toes. I think that the schools will facilitate more social mixing once they're open. And I think that we're going to experience a resurgence. Eventually, someone will develop a vaccine, but don't hold your breath. It's not just the development. Then there's going to be human trials, and then there's going to be manufacturing, and then there's going to be distribution, and then there's going to be dealing with shortages, and then there's going to be the administration. So it's going to be a long time before a vaccine is an actual solution. That is probably what will end up happening. Quick note on that, where did the anti-vaxxers go? I don't know, haven't heard about them. In Israel, I think that it'll be interesting to look at two populations, at the Haredi population and at the Muslim population. Haredi started off on the wrong foot, but they fixed it. And that was an interesting social development to witness. As far as Muslim Arabs, we're in the second week of Ramadan right now, and that will go through May 23rd. And it'll be interesting to see what happens in that community. I think the second front might be, you know, work. What's going to happen at work in the future? That's going to be totally different. That genie is out of the bottle. I heard someone say that there are decades where nothing happens, and then there are weeks when decades happen. I think that's where we are on the whole work front, everything having to do with, you know, e-commerce and telecommunication and employee density at the workplace. I know that my employees are now saying, whoa, wait a second, you know, we worked at home for a month and a half, so wait, why do we have to go back to work? In fact, the whole work from home thing is developing, and that will change forever. And I guess maybe the last front is economy. I'm not an economist, and I don't play one on TV, so I really don't know how the economy is truly going to be affected. What I do know is that they say that this is the worst economic downturn since 2008, which was the worst economic downturn since the recession in the 1980s, which was the worst economic downturn since the energy crisis in the 1970s, which was the worst economic downturn since the Great Depression in the 1930s, which, well, you know, you get where this is going. I think humanity is very resilient. A third of Europe's population died of plague 400 years ago. But, you know, we still invented iPhones, and we're actually having a meeting on Zoom across the ocean by magic. So I think that we'll probably end up being okay.
Good.
Ending on an optimistic note. Michael and Eden, thank you very much. I have just two quick questions, one for each of you, actually. Eden, hoping to start with you. Could you just tell us a little bit about what it was like this week, commemorating Yom HaZikaron, Israel's Memorial Day, and Yom HaAtzmaut, Israel's Independence Day, which are 2 days when the country really comes together, and you weren't able to do it this year. Could you like walk us through what that was like for you?
Yeah, they're really interesting holidays here. very, very different from my experiences with, you know, any kind of Memorial Day or Independence Day in the US. Not better or worse, just very different. I think that, you know, I'm fortunate enough not to have anyone close to me who's really lost their lives as a soldier in the army here in Israel. But I know I was sitting with my roommate and we were watching, you know, the recordings online of all the, you know, national ceremonies, and it was really touching, but it's really hard. You know, everyone talked about how it's times like this when you really want to hug someone and be near people you love. So I think it was extra hard for these holidays when you know, more so than the rest of the year, really want to be reminded that you're supported and with people, you know, physically. So I think that was really challenging for me, and I'm sure a lot of other people. And I think for Yom Ha'atzmaut, especially when I first came here, when I was with JDC, Yom Ha'atzmaut was kind of a big shock for me because everyone is with their family and doing these big barbecues, and I didn't have that because all my family is in the US. And so it was a shock to me, like, okay, so I made a promise to myself that every year on Yom Ha'atzmaut that I would do something with friends and we would plan something. And so it was really sad this year when, you know, I was ready to follow up on my promise, but we just can't. So it was very different atmosphere. People in general seemed like pretty respectful. I wasn't hearing any respectful in terms of keeping the regulations and listening to what we were told. But it was sad not to see the air show and all these things. It's amazing that they moved the air show actually to be above the hospitals, which I thought was amazing. Personally, I was really sad I couldn't see it, but I totally understand. And I think the people who really deserve to see it are the people in the hospitals. So kudos to them for doing that. I think that's amazing. Yeah, it was very different this year.
I can imagine. I saw a lot of people posting about things, and it'll be interesting to see. Hopefully 4th of July on the States end, we're able to go out, but we'll have to see what happens. And Michael, just last quick question for you, especially in a time we're living kind of in this contradiction where we're very focused on our local communities, but this is also a global pandemic. And JDC being such a global organization, what are some actions we can take to support global Jewish community or to support each other around the world during this time?
Well, you know, that might be a question that has many answers. I don't think there's any one way that we can all support, you know, global Jewish communities. But I think that there are some key things that that we can take into consideration that we each can contribute. I think stronger ideas of community, such as this. You know, a community used to be a physical place with face-to-face meetings, and within the context of weeks during which decades happen, we've transformed the way that we think about community. And in an organization that sanctifies visiting elderly Holocaust survivors in their homes in the former Soviet Union, when we can't do that now, to finding what are the alternatives, what can we do, how can we continue to think and support and work outside of the box and try to do as much as possible, understanding that the world has changed and we can't really continue to do everything the way that we were. And to create new communities and new ways to connect that may be more in tune with the post-COVID world. And finally, I think that when we each do our job in our own community, in our own local area, we serve as a beacon. We serve as a light to the nations. Everyone that does their part here in Israel, whether it's in the health sector or the business sector or the civil service, or simply being a law-abiding citizen that plays by the rules and does what we're asked. It shows support for everyone else. You know, when I walk down the street with my uncomfortable, sweaty, stinky mask on, but I see everyone else around me doing it too, we sort of look at each other and say, yeah, you know, we're all pitching in because this is what we need to do to keep on flattening the curve and to capitalize on all of the good work that we've done so far. And so I do my little part, and Eden does her little part, and together our neighbors with us do our part. But ultimately, we're keeping the Jewish state healthy and providing an example for the world about what a cohesive society with unity, equality, and values can do. And I think that that is also one way that we can show viable society and examples for the rest of the world.
Thank you for sharing that. It's a good message to end on. Michael and Eden, thank you again for joining us today. It's on the later side in Israel, and we really appreciate you taking the time. I also want to thank our audience for tuning in this week, and we hope that you will join us next week when we're going to have a conversation with Sarah Eisenman, who is the Executive Director of JDC Entwine. We'll be digging into balancing leadership and family life during times of crisis. I also just want to flag a couple of other things coming up with Entwine. The first is we're having a Shabbat celebration tomorrow at 1 p.m. taking place every Friday. You can find the link on our website. And a very exciting new program we have next week has been designated a new Giving Tuesday. And a lot of Jewish organizations across the country are participating in this partnership. Entwine is going to be hosting a giving circle on Tuesday, May 5th. To raise funds for JDC's global response to COVID-19. We hope that you will join us in this really incredible leadership opportunity and just a great way to give back to JDC. You can learn more and RSVP on our website as well. And lastly, as we do every week, we are creating these virtual programs to help you stay connected to our global community. And it's helpful for us to know how we're doing. So for those of you on Zoom, a Survey Monkey link should pop up as soon as I close out. And you can always be in touch with me as well with any feedback or ideas of what you want to see from Entwine. That is it. Thank you again, everyone, for joining. Stay healthy, stay sane, and we'll see you on our exclusive next week.
Okay, it's been a pleasure. Eden and Ariel, thank you so much. And for our participants, I also just want to say you can follow the work that we're doing at the Brookdale Institute. We have an English website. You can find us, for searching for Myers-JDC-Brookdale and see some of the work that we're doing. We have a YouTube channel and Facebook for those that's currently in Hebrew, but you can take a look at what we're doing. And, we hope to have more opportunities to interact with Entwine in the future. Thank you so much for inviting me. It was a pleasure. Thank you, Eden, and thank you, Ariel.
Thank you. Have a good night, both of you.
Thank you so much.